Good morning, colleagues. It's actually something very difficult to deliver a speech between two elegant ladies like Dr. Huma and Dr. Lacey. Okay, big thanks for you, Dr. John and Dr. Huma, for inviting me to attend to this elegant conference, and congratulations for the 10th anniversary. And thanks again, colleagues, for the recognition of Egypt being the first country achieve the golden tier towards hepatitis C elimination. And thanks again for holding this important conference, which is keeping the conversations and dialogue towards hepatitis B and C elimination, and to speak about the Egypt National Program for hepatitis C elimination. I will start my presentation with this very important study conducted or published in 2014. And thanks to my professor, Dr. Imam Wakid, who leading this important publication, which guided to a remarkable extent our national efforts towards hepatitis C elimination. And in this important study, which assumed that at the year of 2013, we had almost 6 million chronic HCV confirmed cases. And this study assessed and calculated the future disease burden of hepatitis C virus in Egypt in a couple of important complications, like the development of decompensated liver cirrhosis and also the development of hepatocellular carcinoma. And if you see these trend lines, the blue line was reflected the decompensated cirrhosis, and based on that calculation, the study assumed that we would reach at the year of 2016 to the peak of number of the decompensated liver cirrhosis cases, with an absolute number exceeding 145,000 cases. And the red line assumed also that the peak number of HCC cases would be reached at the year 2020, touched the level of 20,000 cases, and would remain constant to the year of 2030. And you can imagine also this huge burden of hepatitis C in terms of the socioeconomic pressures. The second important part of this study put a kind of a modeling for the future projections in terms of the number of infected cases based on different assumptions and scenarios. The first scenario, which is the base case, which is the black line, assumed that everything is kept constant, like the rate of treated patients, the efficacy of treatment. There is no measures, additional measures to ensure the incidence reduction. And in that particular scenario, we assume that we would reach to the year of 2030 with only 25% reduction of the number of viremic cases. The second scenario, which is the blue line, assumed that increasing the efficacy of hepatitis C treatment, but without measures to reduce the incidence. And in that scenario, we would reach to the year of 2030 with a reduction reached to 80% from or compared to the base case. The third line, which is the green line, assume that there's increase of the efficacy of treatment, and adding to this, there are additional measures to reduce the incidence of hepatitis. And by that scenario, we would reach to the year of 2030 with an estimated number of viremic cases reached to a significant reduction exceeding 95%. And actually speaking, this scenario is one adopted by the government of Egypt. And what's incredible in this study, that Egypt succeeded to reach to the targets of 2030 7 years earlier than expected, and we have reached that at the time of 2023. I used to start almost all my presentation with this trend graph describing the burden of hepatitis C all over a time period from 2008 to 2022. And 2008, a demographic health survey described the prevalence of hepatitis C, which reached to 10% of the Egyptian population for the age group from 15 to 59. And you can imagine at that time, you have almost from 5 to 6 million chronic HCV confirmed viremic cases. And in the last survey in 2022, the prevalence of hepatitis C remarkably declined to reach to 0.38% of the Egyptian population in the same age group. And this has paved the way for us to submit the elimination dossier to the WHO to be declared as the first country achieved elimination. And a very historical moment in the 9th of last October, Dr. Tedros handed the certificate of achievement of the golden tier on the path to elimination to His Excellency, the Egyptian President. And this was after a couple of years of conversations and hard work with colleagues from the 3 levels of the WHO to draft the Egyptian dossier for hepatitis C elimination, which was actually submitted 3 times. The first time was in June 2021, based on the Global Health Sector Strategy released by the WHO in 2016. And the second version of the dossier was drafted based on the interim guidance for the country validation, also released by the WHO in 2021. And the last one, in which we succeeded to achieve hepatitis C elimination, was submitted in August 2023, based on the path to elimination criteria just described by Dr. Lazy. And based on the path to elimination criteria, which is categorized into 3 levels, the golden and silver and bronze tier, it's a kind of Olympic tiers, Egypt decided to submit its dossier based on the golden tier criteria, which included the implementation of the 100% of the blood and injection safety, and to ensure that there is more than 150 needle syringes distributed per every person who inject drugs, or even demonstrated 100% coverage increase in the NSP coverage program within the past couple of years, and to reach to more than or equal to 80% of people living with chronic HCV to be diagnosed, and also to treat more than 70% of people diagnosed with chronic HCV, and the settlement and setup of surveillance program or sentinel surveillance sites to allow you to follow up promptly the sequelae of the hepatitis in terms of decompensation, mortalities, and HCC. Where did Egypt stand in terms of the validation data requirements at time of submission? In the elimination dossier, we have succeeded to prove that Egypt achieved 86.7% diagnosis of those who have chronic HCV, and to treat 93.7% among those who are eligible for treatment, and also ensure that we reach to 100% blood safety among the public and private sector, and also 100% injection safety practices within the hospital settings, and increase of the coverage of NSB program within the past couple of years by 100%. This is the terms or the achieved targets that actually verified by the WHO several times through the Regional Validation Committee, in which endorsed the decision of having the eligibility criteria for Egypt to be nominated as the first country for achieve the golden tier for hepatitis C elimination on 14th of September, and also raised to the Global Validation Committee, and also its decision was taken in the 3rd of October, allowing Egypt to reach to the 9th of October with the full recognition of achieving the golden tier. And this is not the end of the story. Actually, we are working extensively to build what's called the sustainability plan for the elimination, including also the several pillars inside the path to elimination, the blood and injection safety, to improve the governance process of the blood donation in Egypt, and increasing the domestic capacity for production of the auto-disabled needles, and the promotion of the infection prevention control measures within the healthcare settings, and expansion also of the harm reduction services, either opioid substitution therapy or the needle syringe program, or frequently updating our knowledge about the estimates of the population or the key populations, and also the prevalence of hepatitis viruses among the key population through the integrated biobehavioral survey, in which we expect the recent results of the Egyptian situation will be available in the first Q of 2024, and also to continue the efforts for diagnosis and treatment, and to enhance the surveillance and surveys to be comfortable and to convenience about the results of the trends graphs about the prevalence of Hep B and C, and also to promote the sequel surveillance protocol in order to strengthen the data about the liver cell failure and HCC and mortalities, and also to promote the HCC surveillance system, and to improve the management of decompensated patients and HCC patients. I will end my presentation by this couple of photos. The first one on the left side, which is taken in August 2019, in which Dr. Tedros handed the verification report of auditing of the country office of the WHO for the nationwide screening campaign conducted between 2018 and 19. And the one photo on the right side is the handing of the elimination certificate in the 9th of October. And between the two photos, there is 1,500 days. It is not a simple 1,500 days, but it represents a robust political commitment and working extensively to keep the efforts amidst a hard period of COVID-19 and even many political unrest around Egypt. And this is my acknowledgement slides, and thank you very much.